Hi, I'm Marco Rodriguez, orthopedic spine surgeon at the International Spine Institute. So I'd like to talk a little about least invasive spine surgery, which is a general philosophy I use when I'm treating the spine. Why I do this? Well, the biggest reason is to minimize your suffering while maximizing your quality of life. One of my passions here is to reduce the rates of fusion. When I was coming through my training, we did a lot of spinal fusions, and I still do that in my practice, but I've tried to minimize that as much as possible. Minimally invasive surgery is a good option for people, a lot of people. However, there's a lot of collateral damage done along the way. The muscle damage, as we spread the muscles to get to this tissue, can cause a lot of pain and increase the recovery time. It can also cause secondary damage down the road. So a lot of surgeons don't do pain procedures, and pain management doctors generally do not do surgery. But there's a gap in between where one can treat pain without major surgery. And I really think that's where our least invasive approaches can help you. A lot of people have a lot of trouble jumping to the next step of spinal surgery because they know that how much it can affect their lives. They can be out of work for 6 weeks or even 6 months at a time after doing this type of procedure. They're fearful of the pain that they can go through. But by using least invasive approaches, we can minimize your time off of work, minimize your pain, and maximize, while still maximizing your results. I really feel patients should explore less invasive options before going to even the traditional minimally invasive approaches. What we try to do at International Spine Institute is to pinpoint pain generators, whether it be the nerve, the disc, the facet joints, and try to hone in on where that pain is coming from. Once we find this, we can tailor our treatment to treat that specific pain generator rather than treating a global spinal issue. We can do this by using techniques including endoscopic discectomies and laminotomies or foraminotomies, freeing the nerves. We can treat the nerve endings that cause facet back pain or back pain when you stand or lean backward with endoscopic rhizotomies. And we can also treat pain from the disc where there's tears and damage to that disc, and we try to heal that through using your body's own stem cells. By using the camera, we can really minimize that incision. It also allows us, the flexibility of moving the camera allows us to direct this camera to exactly where we want to go and not damage the tissue around that area. Many patients have gone through pain management for months or even years with multiple spinal injections, but haven't received the results that they want. Least invasive surgery can be an option for those people that don't want to go to the larger step, but really have not received the results they need from pain management procedures.